Hi, good day. I am Kinsheni M. Presbytero, and in this video, I am going to perform blood transfusion. So, blood transfusion is a life-saving procedure that can help replace blood loss due to trauma, surgery, or an illness. In starting the blood transfusion is we are going to check the doctor's order. So we have here the time, the date, and also the blood to be transfused. So here, secure and transfuse 1 unit whole blood of patient's blood type properly screened and cross-matched transfused for 4 hours. So since the patient is having a cesarean section, is we are going to administer or transfuse fresh whole blood. After the doctor's order is we are going to secure a blood consent for the patient if she agreed for the transfusion. And also, don't forget to affix his or her signature to the form.
As the charge nurse will process the blood request, so the blood request form should be sent to the laboratory or blood bank. So once the form is being processed, the medtech will go to the patient's room and get blood sample for blood typing and cross-matching. So once it is done and the blood is already available, it's time to prepare for the next step for blood transfusion.
Once the blood is available, the charge nurse will send a request form from the blood bank to release from the blood refrigerator. Now is we are going to do the verification. It's either together with the nurse, doctor, or the medtech. So, okay, patient's name, Emily Presbytero. Expiration date, January 7, 2022.
January 7, 2022.
Blood type O+, Rh positive.
Blood type O+, Rh positive.
Blood component, fresh whole blood.
Blood component, fresh whole blood.
Serial number is 1234.
Serial number is 1234.
Just a reminder is that we are not going to use a blood that has a gas bubbles present or it is discolored. And also we are going to check the blood bag and the tubings for any leakage and obstruction. And now we are going to prepare the materials. We have here the blood set, the thermometer, the sterile gloves or clean gloves, cotton balls, stethoscope, and also the waste receptacle. After the preparation is we are going to bring the materials to patient's bedside, introduce self, and check the patient's identity. Good morning, ma'am. I am Kinsheni. I am your nurse for today. So, may I know your name and your date of birth?
Emily Presbytero, April 16, 1972.
Okay, ma'am. Thank you. By the way, ma'am, the doctor has an order that you are going to undergo a transfusion. Are you aware of that?
Yes,
Do you know what is your blood type?
type O.
Okay, ma'am. Have you tried this before?
No.
Okay, ma'am. Thank you so much. Okay, ma'am. I'm going to transfuse a 1 unit whole blood, your blood type which is type O. And then after the procedure, is you are going to inform me if you experience any allergic reactions, okay?
Okay.
Okay, ma'am. Thank you. After that is we are going to check for the vital signs. Good morning, ma'am. I am Kinsheni. I am your nurse for today. So, I am with
Dr. Navarra.
So we are here for the second rotation of the verification for the blood transfusion. So patient's name, Emily Presbytero.
Patient's name, Emily Presbytero.
Expiration date is January 7, 2022.
Expiration date, January 7, 2022.
Blood type is O+, Rh positive.
Blood type O+, Rh positive.
Blood component, fresh whole blood.
Blood component, fresh whole blood.
Serial number is 1234.
Serial number is 1234.
After verification with the doctor, is we are going to prepare for the blood transfusion. So we are going to check for the IV fluid. So the patient has already an IV line, plain NSS, and also no medication infused. And also we're going to check for the IV site for potency, no infiltration, no phlebitis, and also no swelling. So to start the procedure is I am going to wear gloves. Now is we are going to get the blood set from the package. We're going to open this. And we are going to move the regulator to the filter side or filter area. After that is we are going to close the regulator. Now is we are going to insert the spike at the blood bag, and then we are going to hang it at the IV stand or cone. After that is we are going to lightly press the drip chamber, and also we are going to slowly open the regulator until the blood fill the tubing. After the blood fill the tubing is we are going to close the regulator again. So let's just assume that the blood flows already to the tubing, and then we close it. Next is we are going to check if there is no air in the tubing. So if there's no air, is we are going to hook up the blood. Now is we are going to put downward the regulator near the piggyback, and then we are going to close it. After that is we are going to disinfect the injection port with alcohol swab. Now is we are going to attach the piggyback, and also we are going to put plaster to secure connection. Make sure that both ends of the plaster is folded so that it will be easier for us to remove it. Going to open the regulator to start the transfusion at slow rate. After starting transfusion with saline, begin the blood flow. Blood should be administered slowly. It should be 10 to 20 drops per minute at first 15 minutes. After procedure is we are going to stay with the patient and monitor for signs and symptoms such as dizziness, headache, edema, and more. If there is no signs and symptoms of transfusion reaction occur, to regulate according to the prescribed rate. After that is we are going to do the aftercare and do proper documentation. Thank you for watching. Aware of that?
Nagano habang tagtubag oy?
Yes. You said yes.
Huwag ito ba gano'n? Huwag ito ba gano'n?
Na, kaibigan.
No.
Ha?
Hotdog.
Isa kaibigan. Isa nang pangkat.
Saan ka gano'n?
Secret. Sige na, play na.
Oh, yung pinaka ko, maglagay na ito kasi tinog na puro. Maglagay na ito.
Sige na, play na.
Kasi ko ito ba katungkuan?
Yes, yes.
Puro yes?
No.
Maglagay na ito. Sige ito ba kung bubuto na sa anak?